I have endometriosis and I just had an MRI done privately for the first time, and I'm pretty anxious about the results. If you've been following, you'll know that I decided to undergo excision surgery privately. The NHS wait times of 18 months is just too long, and I feel in my gut that my endo needs excision surgery like yesterday. One of the consultants, endo specialists, that I've been seeing privately referred me for blood tests, a urine test and an MRI. Now, I was anticipating that the consultants would want to do their own MRIs. However, I did offer to share the imaging from my recent NHS ones. I go over that report in this post. One of the consultants agreed and requested the images directly from the NHS hospital and then went over them with his MDT and actually spotted an additional bowel lesion. The other consultant requested I do an MRI, which he explained is more specialized, follows a different protocol, and would be performed by an expert radiologist. So I thought, fine, I'm willing to pay thousands of pounds for surgery, what's another few hundred? And in all honesty, I would prefer that the surgeon be armed with whatever investigative scans or tests needed. As I've shared on multiple accounts, an MRI pre-op is so important. It's imperative, which the consultant confirmed, saying, yes, surgery is the only way to know exactly what's going on with your endometriosis. But a scan that's done well is the best way to plan your surgery. Perform risk assessment, manage your expectations, and mitigate the likelihood of there being any surprises. More than that, he added, as a self-funding patient, he wants to make sure he accounts for where my endo is present, puts forward a plan to eradicate as much as possible, if not all of disease, to avoid the need for additional surgeries. So I booked my MRI, hopped on a train to central London, and off I went. I was told to fast for 4 hours pre-scan and that the scan would involve images of my pelvic area and full abdomen up to my diaphragm. So I arrive at the MRI centre and within minutes I'm taken to a changing room, asked some questions and asked to remove any metal as is custom with MRIs and get into a very sexy gown. The scan involved both Buscopan and contrast dye, which were administered intravenously. First, the contrast dye to highlight organs and areas of inflammation within the abdomen. Then for the pelvic scan, I was given Buscopan to help relax my bowel, stop it from spasming to allow for clearer imaging. I don't know about you, but I feel so accustomed to MRIs now that I actually managed to fall asleep, which happened during the scan, most likely because I hadn't eaten since dinner the night before, courtesy of needing to fast beforehand, meaning I had fasted for 14 hours by that point. The scan lasted about 1 hour, and immediately after I received an email with login info to access my imaging, with a report to follow in the next few days. I was also told that the radiographer who's due to report on my imaging is the most in-demand radiologist in London for gynecological health. She's that good. So why am I anxious? What if this MRI picks up on something that was missed by the NHS? Something sinister. Sometimes I would rather that my symptoms and my fears have just been all in my head. I would especially love to be disproven about diaphragmatic involvement. That would literally be a dream come true. On the other hand, I'm curious to find out if this MRI picks up on any endometriosis related to my bladder, even if it's just nerves associated with bladder function. Because I was told after my diagnostic laparoscopy 9 years ago that I had endometriosis on my bladder. However, it's never been detected by MRI imaging, despite being under the care of endometriosis centers, endometriosis specialists with MDT reviews of my MRIs. And yet I have the symptoms: frequency, urgency, pressure with a full bladder. So we shall see. Of course, I ended my fun morning out in London with brunch because I was starving and I deserved a treat. I popped into Urbane and it was divine. Avocado on sourdough toast with a sprinkle of pomegranate and pumpkin seeds, topped with 2 poached eggs and grilled feta. I'm salivating just thinking about it. Anyway, stay tuned as I'll be updating on the MRI report very soon.